My name's Daniel, I'm a GP from the southwest of England.
My name's Lauren and I'm a GP trainee from Yorkshire.
So we mentioned earlier that GP careers are quite diverse. We thought it would be quite nice to have an opportunity to explore the kind of work that both Lauren and I do day to day to give you a bit more insight into what a career in general practice could be like. So Lauren, you're a GP trainee in the north of England. What do you enjoy about being a GP trainee?
I think for me it's the supported learning that we get as a GP trainee. So as part of every placement you get a fully qualified GP who is your supervisor for the placement. Sure. And they really look after you and make sure that you're happy with the care you're giving your patients, but also help develop you as a GP. After every clinic, so even as a GP trainee, we see patients, and after every clinic we get something called a debrief, where the GP goes through each patient with us, looks at our management plan and our diagnosis and makes sure that we've done everything correctly. It's a great learning opportunity there, and if we have done something wrong, we can always ring the patient up and correct it. So I never go home worrying at night because I know that I'm being supported, which is really great.
Sure. And what does a typical kind of week look like for you when you're in training?
Yeah, so as I mentioned, we do clinics. So on a Monday, I normally have a full day of two clinics, a morning clinic and an afternoon clinic. And we do home visits in between. And on a Tuesday, we start with a morning clinic, but then I get something called half-day release.
Right.
Half-day release is an educational opportunity for all the GP trainees from the region get together, and we learn about all sorts of GP topics, from consultation skills right through to how to manage a medical problem within the community. It's just a great opportunity to get together and learn. Wednesdays is another clinic day. Thursday morning I start with a one-to-one tutorial with the GP that supervises me. That's really individual learning. We normally set the topic together, so I really gain something out of that, and it's really great learning. And then on a Friday I get half a day private study. That gives me time to finish any work that I might have outstanding, but also to work on my e-portfolio, which is an online kind of portfolio, and it helps show our development through the 3-year training programme.
So it sounds like a really diverse week and kind of really nicely balanced with different activities. I know we also do some hospital placements as part of GP training. What kind of things did you do? You do 18 months ideally in hospital, and that's 3 jobs of 6 months. I did an acute medicine unit placement, which is the step after A&E, so we're still exposed to some acute medicine. I did a psychiatry placement, which is so important for general practice, and I did care of the elderly job, which I absolutely loved. So really mixed and varied hospital experience. I know when I did it, I did obstetrics and gynecology, paediatrics, and accident and emergency. Again, really good foundations for being a GP, but I think also just having that ability to work in the hospital, understand things from that perspective, but then go into general practice and see how the two relate it's a really great training experience.
Yeah, definitely. So now you're fully qualified, what's the plan?
So before I started my GP training, I was quite interested in international work, and I spent about 4 years working abroad before I went into my GP training program. And so actually that was an important part of my kind of career aspirations. So one of the years that I worked in that I did for my GP training included a year out working abroad. So I went to work in Malawi, and I worked in end-of-life care out there because that was a particular sort of interest of mine.
Wow.
I came back to the UK as part of that year and also did some work in hospices and end-of-life care in the UK to develop a special interest. So those are 2 things now, having qualified, that I really want to take forward. So I'm still interested in international work and keeping up that special interest, as well as working in the medical school, teaching medical students, and also VTS, or also teaching trainees in GP.
You mentioned some kind of specialist interests and opportunities. Is there plenty out there for GPs?
Yeah, I think for me personally, one of the great things about general practice is the flexibility. So once you qualify, you can really build up an interest in almost any other area of medicine you're interested in. So as I said, I've got that interest in end-of-life care, but I've got friends that work in the hospital. They do their normal GP work in the week, a couple of days a week, but they also go into hospital and work in cardiology or heart medicine. They also can work in the accident and emergency department. They can also do minor operations and things like that. So really broad, but then outside the kind of hospital environment, I've got people that are interested in sports medicine, expedition medicine, again, international aid work. Really, the kind of list is endless. So lots of opportunities there.
All sounds great, but there must be some challenges.
Well, I think, working in general practice or just generally in healthcare at the moment, it's really busy profession. Day to day is busy, and that can build up some pressure in terms of the workload and things. And your cases are diverse. You're seeing anything from small children to elderly care to pregnant ladies. So there's a real mix there, and that means that you've got to keep your learning up in lots of different areas. But I think that's an exciting challenge to have, and I think that that keeps it interesting and keeps it relevant.
As you mentioned, we know that GP can be quite busy.
Yeah.
Does it affect your work-life balance at all?
So I think that's a really good question, and choosing any career in medicine, you have to think about those kind of things. What I think is really great about general practice is the flexibility in your working week once you qualify, choosing the kind of activities you do and when you do them. So in my working week at the moment, I've got a young daughter. I get to take a day out of the week to look after her. That's important to me. But then I get to make up my working hours by doing some out of hours work at other times in the week. So I think really choosing the kind of activities you do and when you do them is a great privilege to have. So I'm really, really happy with that.
And I suppose to finish, what is the best thing about general practice for yourself?
So I think the thing I love about general practice is that every day is different. I walk in and I really don't know what I'm going to get that day. I think that keeps it interesting. That keeps it interesting for the day, for the next week, and for the years to come. And really to be part of a team that serves my community and looks after them is just a great honour. And a privilege. Yeah. And go on then. So what's the one thing that you love about GP training?
So as a GP trainee, I think it's when a patient asks to see me again after seeing me previously. So for me, there's no better compliment for a patient to ring up and say, can I book in to see Dr. Wogan again? And that makes the job definitely worthwhile for me.
Yeah, absolutely.
So thank you very much for listening. We hope this has given you a bit of an insight into what we do on a day-to-day basis as GPs.